John Rugge.
Dr. Rugge.
John Rugge.
John Rugge.
Dr. Rugge.
Dr. Rugge.
I started with John back in 1979.
My name is John Rugge, and I was here at the beginning for Hudson Headwaters. Started off as a physician, ended up as a physician, and in the middle became CEO and founder, I guess. The Adirondacks became a second home because of the annual Hudson River Whitewater Derby. Brought me to whitewater canoeing and canoeing the Hudson River, which is one of the very best rivers in America. And turned up at Glenn Hospital saying I was a physician and I was interested in working in the ER. Was shocked to find there were no positions open. Had no idea what to do. But some 15 miles away in Chestertown, there were 3 physicians, 2 married to one another who were planning on retirement, and not a surprise. But the other, a 42-year-old person in mid-stride, decided to leave town that summer, and the town was left with no doctors. The town supervisor, Howard Swan, created a search committee, and the search committee ran advertisement. Howard was clever and was able to run articles in the New York Daily News about this little town that needed doctors. So, turning up with no prospects, Howard Swan, together with the members of the committee, went to Glenn Hospital. And so we just don't know what to do. We are losing all our medical care. And at that point, the ER under Dr. Hauser, Fritz Hauser, was precepting several PAs, the first people going through the Hudson Community College program, Hudson Valley program, as physician assistants. So Dr. Hauser, together with Bill Fillion as president of the hospital, responded by saying, well, we've got these PAs and we could have an extension of our ER right up there in Chestertown. But they would have to have a supervising physician, but somebody came back last week who was interested in work and maybe he would do it. So I found myself as practicing in Chestertown with 4 PAs, 24 hours a day, round-the-clock coverage, with a life plan of staying for 6 months.
6 months?
6 months. There was nobody to take my place, so how do you leave? The hospital would run the operation, collect the fees, at the end of the year, total up the profits, pay the mortgage to the town, pay the town for the mortgage, and then divide any remaining profits. It didn't work. There were no profits. After 1 year of everyone scratching their heads, Dr. Ed Lawrence in Warrensburg, the last practitioner in Warrensburg, 12 miles south, called a meeting of the area physicians to say that he was giving it up. But then in the meantime, 2 other communities lost their physicians, same kind of dynamic. So we had 4 health centers operating in 1978, and losses that were becoming unsustainable, and the hospital reimbursement had been constrained during this time. So I had a letter in my drawer indicating we were closing the Chester Health Center, which I was reluctant to send, and received a phone call from a lady who said her name was Susan Holloway. It turns out there was a grant application available and due in 3 weeks for the Community Health Center program. What did I know about that? I was calling from the Chester Health Center, and we had the Warrensburg Health Center, the North Creek Health Center, the Indian Lake Health Center. But I had to tell her, I've never heard of the Community Health Center program. What is that? Applied, 156 pages in 3 weeks. We turned out approved, but not funded. In the meantime, New York State issued its very first grant for primary care. And we'd just written the federal grant, so we dusted it off and rewrote it a little bit, sent it in. And that grant was not only approved, but also funded. So that allowed us to continue, and a year later, federal grant was approved. I had to come up with a name. We couldn't send a big long name in with 4 health centers, and I had come up as a canoeist with the name Hudson Headwaters Health Network. So we, at that point, had a health network.